Hello, everyone. Welcome to another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Foundation. My name is Laura Esfeller, and I am your host of this podcast, brought to you by the Judy Nicholson Kidney Cancer Foundation with gracious support from Merck. I am so thrilled today to have Dr. Cristiane Bergerot with me. She is a phenomenal physician in the space, but also really an advocate for patients and caregivers within the kidney cancer community. So I'm really excited to have her here with us today. Welcome, Dr. Bergerot, and thank you for joining us today. I'd like first maybe to start with you sharing a little bit about your background and how you came to focus on quality of life for cancer patients.
Oh, awesome. Thank you. Thank you, Laura. It's a pleasure to be here today and also talking about so special thing. So my background is in psychologist based here in Brazil. And I can say that early in my career, I saw how patients' psychological well-being directly influenced their treatment experience and also outcomes. And this led me to specialize in psycho-oncology with a particular focus on understanding and improving the quality of life of our patients throughout their cancer journey, and especially those with kidney cancer.
Thank you. And psycho-oncology is such a specialized field. And to be honest, I wasn't familiar with it before my diagnosis. And I feel like most patients and caregivers probably are similar. So could you maybe explain a little bit about what psycho-oncology is and how it plays a role in people's cancer care?
Sure. So psycho-oncology is a field that addresses the psychological, emotional, social, and behavioral aspects of cancer. For patients with kidney cancer, for example, this means recognize and treating distress, anxiety, depressions, fears, and concerns that can arise throughout diagnosis, treatment, and also survivorship. It also involves supporting patients in navigating their uncertainties of the disease and promoting strategies to improve emotional resilience and also their communications with the healthcare team.
Thank you. I think it's a part of cancer treatment that is unfortunately overlooked in a lot of cases. And in your experience, what are some of the common psychological and emotional challenges that patients with kidney cancer face? And how do you feel like their healthcare providers can better address these issues?
So I would say that most of these patients will experience a deep sense of uncertainty, also fear of cancer recurrence or fear of cancer progression. They will also experience a lot of emotional distress, especially when treatment have complex side effects or even when the outcome are unclear. I would add that fatigue, for example, or change in physical function and shifts in identity can also weigh heavily. And providers for sure can help by routinely screening for distress, creating space for emotional conversation, and also referring their patients to the psycho-oncologist service or psychosocial oncologist service or support groups early in the progress. So not just when things become overwhelming, but since the beginning.
Yeah, and I think you bring up a good point because that typically changes over time, right? Your experiences and how you're dealing with your cancer diagnosis and treatment can look very differently from year to year, even month to month, or sometimes week to week. And I think that's a really good point. And I'm glad that you brought up like how some of the side effects of treatment also impact your kind of emotional and mental well-being too, right? Like fatigue was something that I really struggled with whenever I was on treatment. And if people go, oh, you're just tired, I said, no, this is more than just feeling sleepy. And I think it's something that whenever you have a provider like yourself in the picture, it helps to also keep patients on treatment longer, it seems, in some cases.
Yes, definitely. And especially for fatigue, we have a lot of research right now. So we do know that the cognitive behavior therapy is an important resource for our patients to help them to better cope with their fatigue. We have also published a recent study in which we have noted that a mindfulness app intervention can also help our patients to better cope with their fatigue. We know that the physical activity, like the exercise, can help them to prevent or even to mitigate some of the side effects. So I would say that we truly need to talk a little bit more about what we are experiencing during the treatment in order for our healthcare providers to know exactly which type of research they can plug us in, and also how we can try to mitigate a little bit more. Have cancer and doing treatment doesn't mean that we have to suffer or that we have to feel bad about all these side effects. No, we do have a lot of research that we can use for us to better cope with all of these challenges.
Wow, I love the way that you said that because I think that it is a bit of an issue with a lot of patients where, you don't feel good while you're on treatment but you don't want to come off of treatment, obviously. And so I know something that we've talked about on this podcast before is sometimes patients feel nervous and uncomfortable talking with their physician about the side effects that they're experiencing because they don't want to be pulled off of treatment. And so it sounds like with some of these factors that you have, that it can really help with mitigating some of those concerns. The mindfulness app, I'm just curious about that. Are we talking about like the apps you can just find on your phone? Is there a specific one that patients kind of gravitate towards?
So it was one specific that was developed by a group in Canada led by Dr. Linda Carlson. So she's an expert in mindfulness and also in other integrative interventions. And they have developed this app in partnership with a group in Switzerland, if I'm not wrong. And it's really interesting. So in English, you're going to hear her conducting most of these intervention in partnership with her colleague, David Specka. And it's really easy. In our study, we just requested our patients to do 20 minutes per day and at least for 4 days per week. So in 7 days, just 4 days. And they can do it when they wake up or when they are going to sleep or when they are walking. It really doesn't matter. It just matters the fact that they need to do this exercise. And they did that over 1 month. And so I think we have reduced more than 33% of their symptoms. And I think the improvements were really inspired and really brought a lot of attention for us to maybe try to develop something that can have a broad attention. But all patients can download this app. It is available on Apple Store or also in the Android. And the name of the app is AMDTX. And you're going to see that there is like one specific module for patients with cancer. It doesn't talk about cancer or about treatment or anything like that. They just use all the mindfulness interventions that prove to be effective for these patients over the past of 30 years of studies.
That's amazing. Thank you for sharing that. Because again, I feel like it's also important for patients to feel like they are able to do something to take control back over their bodies and their treatment. And this feels like a really good way to do that by participating in something that can help you feel better. So for exercise, I know, and at ASCO, I know at the ASCO meeting in May, they were talking about, I think it was a colon cancer study, right, that showed that exercise helps outcomes. But when you're not feeling well, going through treatment, it can be a little challenging to motivate yourself to do exercise. Or maybe that's just me, I don't know. How do you recommend for patients to incorporate exercise into their either daily or weekly activities in a way that can help them have those benefits whenever they're really feeling like I don't want to do that today?
Yeah, I think it has been incredible, all the positive results that we are seeing right now on all this research that includes exercise. Also, the research that we have developed here in Brazil, we are seeing similar results. And in fact, if you review the literature for fatigue, I think it is one of the most recommended ways to treat fatigue. So, despite the fact that it's really like weird to think about, so I'm so tired, how I'm going to move my body or to walk a distance or how I'm going to do that. I think we should definitely think about that. This could be a great option for us to try to mitigate some of these symptoms. I would say we have to think about on what we are able to do right now. So it doesn't need to, okay, I need to go to the gym every day and to spend 1 or 2 hours there. No, I think we should try to find something that it's that fits with the way that we like our life. So I think if we can start, for example, with a short walk distance, we can try that. The part is we need to move our body, and this is really powerful for our health and especially for our mental health. So I truly recommend you to find something that it's meaningful to you. Someone, for example, there are a group of patients who likes to dance, so why not start dancing? And there are other ones who likes to walk with their dog, so why not? I think this could be like a great excuse for us to start walking, or even those who likes, I don't know, to stretch themselves or to do some light exercise. But I think this is really important to to move our body and to keep our courage and to try to establish like some goals, some feasible goals. So we do not need to run like maybe 10 miles a day, but for sure, if we try to set up some small goals for us, it will be feasible and we will be glad that we are able to do that. And this will encourage us to keep going and also to keep doing. So I think this could be like a great way for us. But for sure, if exercise is not something that match with your own, like with yourself, I would say let's try other things. Like we can definitely try to find other ways to help you to cope with these side effects and especially with fatigue.
Yeah, I think too, you bring up a great point about how exercise doesn't necessarily need to be running a marathon, right? And also that the things that you want to do as far as exercise may change, right? After maybe surgery or going through treatment. I had not never really done yoga before. Whenever before my diagnosis, like maybe had taken a few classes, but never had really done it seriously. And then the local hospital near me at the time was offering these like gentle yoga classes, and that's how I started doing that. So I think just maybe being creative about how you find your exercise. To your point, it sounds like just the act of moving is the most important part.
Yeah, it starts simple.
Right,
That
right.
is the most, I think, the most important tip. So start simple and focus on what it's really meaningful and doable in your life.
Yeah, absolutely. You have really focused a lot of your research and career on quality of life. And I feel like it's a phrase that we utilize a lot in the community, but can be open to interpretation sometimes. And so I'm just wondering, how do you measure quality of life in a clinical setting, especially wherever we have patients who have a range of emotional and physical and financial challenges? What's your marker, if you will, for quality of life?
Yeah, I would say that quality of life includes, so I would say maybe encompass more than physical well-being. So for patients with kidney cancer, for example, important factors include emotional health, cognitive function, social relationship, financial stability, independence, a sense of meaning or purpose, as we were talking right now about. I would also mention that feeling heard, supported, involved in the decision making, this will also contribute. So it will play a big role to our patients' overall well being. So when we think about how we can measure it, so right now we do have some validate patient reported outcomes measures in which I think most of our patients have already answered some of these questionnaires. So it's where we ask about symptoms, emotional well-being, or daily function, or practical stuffs. So these tools give us a structured way to listen to our patient's voice and try to prioritize exactly the impairments or the needs of our patients in order to help us to better determine which type of treatment we should offer or which type of research we should offer to our patients. But I would say that this is not enough for sure. I think we also rely on our open conversation because sometimes what matters to our patients doesn't fit exactly into all these questionnaires. And combining both approaches can give us like a full picture of what our patients are experiencing right now. I think right now we are trying to find the best way to capture all these aspects that I have talked, but it's really hard. So I think the questionnaire is a great way for us to start. But we are seeing a lot of research also trying to understand a little bit more using the wearable devices to see the movement of our patients, to see how their sleep quality and everything else. But I think even with all of these tools that we are using right now, we definitely have to include the conversation with our patients because this will give us a sense on what really matters to them.
Yeah, and I think that one of the things that we as patients sometimes don't understand, and I'm speaking on behalf of myself too in the beginning, right? Is like you go to the doctor and they give you 5 forms you have to fill out, right? And there's some overlap, at least from your perspective as a patient, of wait, they just asked me about such and such. And it's like I remember one time in my doctor's office, this is pretty early on in my oncologist's office, and they're like, on a scale of 1 to 10, how depressed are you? And I'm like, I have stage 4 cancer. What do you think? But now, as I'm more involved in like research advocacy, I understand the purpose of not only these questionnaires, but also why that you have to do them within a certain time of frequency and stuff like that. And so I appreciate you giving that insight to our listeners because I think sometimes it can become a little frustrating or burdensome to have to fill out so much paperwork, right? But if you know that there's a purpose behind it, I feel like it helps ease that frustration a bit.
And I would say that is also a way for us to start this kind of conversation with our patient. Sometimes it's hard to ask how distressed they are with all the situations, or sometimes the patient feels surprised to listen to this kind of question. So I would say that this can also be used as a way for us to talk with our patients or the other side to talk with our healthcare providers. So I based on that list that sometimes we repeat the same questions in a different order. So you can see exactly, at least based on the past studies, what patients with this kind of cancer or doing this type of treatment are always suffering. So this can help you to prioritize a list around your unmet needs, which sometimes it's a little bit challenge for us to think what exactly we're coping with or we're dealing with. And this can also help us to ask for some help or even to see, okay, so what can I do? What should I do with all of this stuff that I have like just highlighted in these questionnaires? Or even to talk about those items that are not included in this questionnaire. So I think this is a great opportunity for us. Keep this in mind when you're start like answering all this form, just to make sure that we will be able to fully, maybe not fully, but at least try to understand a little bit more all the aspects that right now it's not easy for you.
Yeah, it's a tool in the toolkit to help our doctors better understand what we're going through. So we've talked a lot about patients. I do want to talk a little bit about caregivers because we do have a lot of caregivers that listen to the podcast. And for our caregivers who they're usually juggling multiple responsibilities with not only their loved one, but just trying to keep their life outside of cancer afloat, how can they maintain their own quality of life whenever they're supporting their loved ones with kidney cancer?
Yeah, I think this is a really important chapter of the cancer care. We already know that patients often deal with the physical burden of the disease, but we know that the caregiver have all of this other stuff to carry and also to deal with. So they have to carry the emotional and the logistical weight of coordination, support, and sometimes also the financial stress. And what we are usually seeing is that caregivers tend to suppress their own emotion to stay strong for their loved ones. And this definitely can lead to burnout or even to the feeling of isolation. So we definitely need to acknowledge and validate their experience, not only the patient, but also the caregivers, because this is really crucial. And this will allow us to understand exactly when and how we can support them and which type of support we can offer to them, because definitely they need some specific space to talk about and to share a little bit all their concerns and everything that they're dealing right now. It's not easy to be a caregiver.
Yeah, no, absolutely. And I do want to remind our listeners that the Judy Nicholson Foundation does provide a few different caregiver specific groups, both online and also our friend Jayla Barnes has an amazing monthly meetup that she does virtually for caregivers. And there are some support mechanisms, not just within Judy Nicholson Foundation, but also in the broader community. And so I'm curious, Dr. Rowe, what are some of the most helpful support systems that you've seen for help patients and their families with quality of improving their quality of life, whether that's specific interventions or if there's kind of other things that you tend to recommend for patients and caregivers looking for support?
So I would say I would start like with the simple practice like accepting help. I know that most of our patients and also our caregivers, they have some difficulties in accepting help or even to request help. I think we have to understand that sometimes being a patient or being caregiver, the other one who is at our side, they do not know exactly which type of help we need or how we will be more supportive for this person. So we really need to literally say what we need from another person. So, for example, if we need someone to take our kids from the school, or if we need someone to go to the grocery shop, I think this is something that sometimes we believe that it's everyone can do it, but no one knows exactly that we need this kind of support. I think this simple practice of telling what we need and also to accept help, I think it is the first step. And I think the next will be to setting some boundaries and also to seek emotional support through therapy or even to peer groups. These will make a big difference. I think this will also help us to keep our focus on how we can support our patients or how we can be a patient and to cope with all the challenges that we are facing right now. And I think this will make things a little bit clearer. And the support group that you have mentioned, I think it's really powerful because we are going to see a lot of other persons that are dealing or that are living a similar challenge that we are right now, or even that they have lived this before. And they have some practice tips for us on how we can better cope or how we can better walk through this journey. It's not like an easy journey. It's not. And every journey will be totally unique. However, we definitely can find some pieces of stories that can help us to find ways to cope with this. And I think every time that you face yourself struggling with something or seeing that all your emotional symptoms are getting worse and that you're not like sleeping that you're having like some trouble to sleep or even that you're not eating well, I think ask for help. Talk to your medical oncologist, talk to your healthcare providers that you need to find some kind of assistance. Sometimes you're not like needing in that kind of need that you're like experience like some high level of anxiety symptoms or high level of depression symptoms. But it could be like a powerful moment for you to receive all the research that you need to, instead of getting worse, to get better through all this journey. And receive assistance or even a help from others, it's a synonym of power and not that you are weak. It's literally, for example, when we are studying, when we are in our school and we have a teacher who give like some new knowledge and then we can use whatever we want and we can create some important things. I think we can find this kind of help or try to understand this kind of help in a similar way. It's the only person who can change what you are living right now. It's you.
That's so powerful because I think patients and caregivers alike a lot of times do feel like they don't want to burden other people with what they're going through. And unfortunately, in some cultures, cancer kind of carries this shame too, right? But to your point, I think that there's nothing to be ashamed about with a cancer diagnosis, of course. And also, there's no shame in asking for help. One thing, whenever I was diagnosed, that I noticed was a lot of people wanted to help and just didn't know how and didn't want to be intrusive. And putting together a list of here are the things I need help with this week was really important. And now there's Chat GPT and all that would have been great to have when you use AI to help me put together a list. Back then, I didn't have that.
Yeah, and there are like some patients who want like to pretend that nothing is happening, so it's okay.
Right.
Let's talk about all the things that it's running right now around us. But there are ones who really want to talk about. So why not tell, okay, I really need to talk a little bit more about my fears or about my last appointment with my physician or that I am worried about my next exam. So I think we're different persons with different characteristics. It will be really helpful if we let the people around us know what will really help us to navigate all this stuff.
Absolutely. You are very involved in research and all, which thank you for all that you do. And I'm just curious, what advancements in either psycho-oncology or cancer care in general have you seen lately that really give you hope for the future of kidney cancer treatment and for patients and their quality of life?
Yeah, I would say for kidney cancer, we are having a lot of like great news with more powerful treatments that definitely bring us a lot of hope. It has changed a lot what we were expecting, for example, in the last 15 years. It's totally different to have a kidney cancer nowadays. And all these new treatments, and I think all the experts that we work right now, they are really creative and finding different ways to find the cure for our patients. And thinking about the quality of life, I would say that we are also in a great moment. So there is a growing recognition that quality of life matters just as much as clinical outcomes. And we are seeing trials incorporating patients' reported outcomes more routinely and more cancer centers offering integrated psychosocial care. So I would say that this is really powerful to minimize some of the stigma around the psychosocial care and around the psychosocial support. Also, the digital health tools are expanding access to emotional support and follow-up care. I think one example, it was the one that I gave it before around the mindfulness app-based interventions. And these trends make me really hopeful that we are moving towards truly whole person cancer centers. So on October, we are going to have the ASCO Quality Care Symposium. I'm not sure if we will be able to be there, but it's like a great opportunity for us to really know more research that are available to our patients right now, and especially considering all these innovative options that we have, and also the use of the artificial intelligence and what else. I think this is really powerful if we can use in a positive way to help our patients to better understand about their diagnosis and about their treatment and about their treatment options, because I know that sometimes it's not easy to ask questions to their physician, but it's easy to ask to a computer. But even knowing that the response could be not accurate or not like something that it's applicable to their own case, but I think it's a way to start. We need to look exactly what is happening with us and how we can, and for us to find the best way to get help or even to cope with in a positive way that will increase our quality of life, will keep our independence, and will keep our functionality, and also will keep our mental health in a good way.
Absolutely. Yeah. I haven't made it to ASCO's Quality of Life Symposium yet, but I hope to at some point because I do think it's a really important part of patients and their treatment. And, I'm glad that this is becoming more of a focus for our physicians and the research community, because it's obviously you want to have progression-free survival and all those things that we talk about, right? But what good is that if you don't feel good and if you have terrible quality of life? So I think it goes hand in hand. So before we wrap up, are there any kind of final thoughts, or what would you say to kidney cancer patients and their caregivers who may be feeling very overwhelmed or isolated at this point in their journey?
Yeah, I would say you're not alone. So this path is difficult, but there is support and both clinically and emotionally available to you. So please don't hesitate to ask for help, to connect with others who understand your experience, who are great listeners. And remember, it's okay to feel overwhelmed. It's okay to feel sad. It's okay to cry. It's okay to be angry. What matters is finding small steps each day toward what gives you strength, meaning, and comfort.
I think I'm gonna need you to make some like affirmations for an app or something because I think I need those reminders too every day. Thank you so much, Dr. Roger. I really appreciate your time and appreciate all that you do. Like I said earlier, I think it's wonderful that we have someone like you in our space and in our corner because our physicians and researchers are phenomenal, but sometimes this part gets overlooked. And so I really appreciate that you champion this for patients and caregivers.
Thank you. Thanks so much for this opportunity.
Thank you. So again, this has been another episode of Real Talk on Renal Cancer. Thank you so much to our sponsor, Merck, and the Judy Nicholson Foundation. And we will be back with another episode soon. Thanks so much and have a great day.